Though an increasingly used treatment for depression and other disorders, it continues gaining support from members of the medical community. But affordability and insurance coverage challenges are keeping many people from using it. New at 6, Eric Nacton, he has details on how ketamine could become more accessible.
From homeless people to affluent people and everywhere in between, suicide numbers have largely been on the rise in recent years throughout many parts of Hawaii. Many feel insurance coverage of ketamine could help make a drastic difference. Wednesday, the Senate Committee on Ways and Means, plus the Committee on Commerce and Consumer Protection, considered SB 279. It would require medicated and insurance coverage of ketamine therapy to treat depression.
Ketamine is a relatively old drug with a reliable history in a medical setting. There are many studies that have proven in a controlled medical environment, injectable and IV protocols are statistically significant in treating and resolving many psychiatric diagnoses.
After all other options were exhausted, I tried ketamine therapy. I experienced immediate relief from my symptoms, a relief I never thought possible.
Numerous mental health professionals have seen astounding improvements.
Ketamine has provided profound, life-changing experiences for many of my patients over the last 8 years. Some of these patients have been on every single antidepressant medicine that is FDA approval. The part that's infuriating to me is that only folks that have the financial resources can take part.
Ketamine is considered by some as a form of psychedelic. Most commercial insurances won't cover it.
The HMSA's comments talked about that the reason why they're not covering ketamine is because it's not FDA approved.
Yeah, I think the role of the FDA is to mandate coverage, but if they don't mandate it, it doesn't mean that it doesn't also need to be covered. Saying that the FDA approves Spravato, but not a superior treatment, IV ketamine, is like saying we don't want to approve it because they're not going to force us. And that's not the right thing to do. Right thing to do is decide what is a vital life-saving treatment.
This week's recommendation was adopted by committee members. Meanwhile, decision-making on the measure has been deferred until a later date. Eric Nacton, Island News.